Dear audience, dear chair, let me introduce my PhD topic entitled Dental Management of Children with Special Needs. My name is Lili Rozgonyi. I'm a first-year PhD student and a pediatric dentist at the Department of Pediatric Dentistry and Orthodontics. My vision is that all children in special care are smiling, and to achieve that, I would like to evaluate the effectiveness of alternative dental management in case of these children. I have two specific goals and two ongoing projects. Both of them started this autumn. The first one is about non-pharmacological behavioral management of these children during the dental treatment, and the second one is about dental prevention. The title of my first project is Investigating the Effect of Alternative Distraction Techniques and Dental Environments for Children with Neurodevelopmental Disorders. A little background about the topic. NDDs are increasing globally in the 21st century, affecting 53 million children under 5 years. Due to their behavior, these children are more vulnerable for oral health diseases, where 60% of children with autism have dental caries. Oftentimes, they require general anesthesia for a regular dental treatment, placing them at risk of different side effects, but this is not always necessary. So there is an unmet need for some less invasive calming technique, leading us to investigate alternative dental environment and distraction techniques. During the use of these techniques, it is important to measure the children's behavior and cooperation and the dental anxiety with physiological parameters and with certain scales, where the Frankel scale and the Wenham scale are the most commonly used ones. Therefore, our aim is to identify the best alternative distraction technique for children with NDDs. Our clinical question is, what is the effect of the different distraction techniques and dental environments on dental management in children with NDDs? We use the PICO framework, and we hypothesize that the use of these techniques are superior to conventional dental practice. The clinical implication would be tailored protocols for dental treatment of these children, where there are less invasive dental treatments and less pain and less stress for these children. Here you can see a summary of my key articles. In case of population, they are children with different types of neurodevelopmental disorders. They are exposed to the same intervention and controlled dental environment. And in case of outcomes, you can see that there are both objective and subjective outcomes. We conducted our systematic search on 10th of November with the 3 domains below and on 5 databases. The first domain is referred to the neurodevelopmental disorders. The second domain is related to the dentistry field, and the third domain contains all types of distraction techniques and dental environments. Here is the flow chart of the selection. After the duplicate removal, we got more than 3,500 articles, and after the title abstract selection, we ended up with 92 eligible articles with the Cohen's, and we have the Cohen's kappa 0.81. Here you can see a progress of my first project, that our topic is feasible. We submitted our Prospero, we did the duplicate removal and the title abstract selection, and we are about to start the full text selection with my co-investigator. So let me move on my second project, which is investigating the effectiveness of visual oral health educational techniques for hearing-impaired children. Hearing loss affects approximately 34 million children worldwide. Due to communication barriers, they develop higher risk of oral health problems. There is a significant difference between non-hearing impaired and hearing impaired children's knowledge about proper toothbrushing technique. As we know, maintaining a good oral health is essential for physical health and well-being. And if a child has severe oral health problem, he or she can have problems with eating, sleeping, or concentrating. So we have to do something against it. That leads us to investigate the dental education of these children, which has been a vital part of preventive dentistry to improve the oral hygiene. Therefore, our aim is to identify the best oral health education technique for children with hearing impairment. Our clinical question is that are visual oral health education techniques effective in improving oral health in children with hearing impairment? We also use the PICO framework, and we hypothesize that hearing-impaired children receiving visual oral health education will have better oral health indices. The clinical implication would be to make dental health lessons more accessible for these children, so later they will need less invasive dental treatments. We conducted a preliminary search on 3 databases with the 3 domains below, and we also recognized some key articles. Here you can see a summary of my key articles. In case of intervention, there are different types of visual oral health education techniques, and they are comparing to sign language, which is a gold standard communication for these children. And for the outcomes, there are different kinds of oral health indices. As a summary, I would like to submit my first project the next year, September, and the second project in 2026, June. And I would like to end my presentation with a quote from Stephen Hawking: "The greatest enemy of knowledge is not ignorance, it is the illusion of knowledge." Thank you for your attention.
Thank you very much. Any questions from the audience?
Congratulations on your presentation. I would like to ask that what is the difference between a sensory adapted dental environment and the regular dental environment?
Thank you for your question. So these children with neurodevelopmental disorders are very sensitive to sensory stimulation. So in a sensory adapted dental environment, we can reduce this sensory overstimulation with some visual adjustments. So we can use dimmed or colored lights to avoid the bright lights, and some auditory adjustments. So we can use some headphones so they cannot hear the voices of the dental tools, and we can also play some calming music for them. And there are also some olfactory adjustments that they can smell lavender or some relaxing smell instead of the antiseptic.
Hello, thank you for your presentation. Do you think in your first project this increases the risk to the dentists? Like this calming, instead of putting them under general anesthesia? Because I assume these children are more likely to bite, and if they, I don't know, have a panic attack or something in the middle of the procedure, isn't there an increased risk to the dentist?
Sorry, can you repeat your question? So,
because you said that generally these children are put under general anesthesia?
Yes.
But so then, like this, they would have headphones and all of these calming things, but if it doesn't work, then doesn't that put the dentist at an increased risk of harm because the child might bite them or something?
Yes, but if you work with these children, you know that you will not know their next step. So yeah, it can increase the risk of the dentist, but in case if you work with these children, you will also be prepared for these actions.
Thank you.
Thank you.
Thank you. It was a nice presentation. I was wondering if you are planning to do a subgroup analysis, and if yes, then how is it possible? Or
Thank you for your question. Yes, in case of neurodevelopmental disorders, I am planning to do a subgroup analysis if there will be enough data available. I'm planning to do a subgroup analysis in case of children with autism and with intellectual disorders, because these are the articles that are most common.
Thank you for your answer.
Congratulations for your presentation. I'm just curious, is there any center where they already use these alternative techniques in Hungary?
Well, yes, we are trying to use them at our clinic, but we don't have any guidelines for it yet. So I don't know other centers who are using these techniques here in Hungary.
And may I ask that what kind of techniques are you going to
here?
Uh-huh.
Okay, so we are using some distraction techniques. For example, during the dental treatment, these children can see their favorite cartoon or listen their favorite music, or they can have a headphone, so they cannot hear the dentistry tools, the voice of the dentistry tools.
It's really interesting. Thank you.
Thank you.
Congratulations for your presentation. I have a question for your second project or topics. How to imagine the visual oral health education? It's the film or the pictures, or how does it work?
Yes, there are also pictures and also videos where they show how the children has to brush their teeth properly, and yes, they are using pictures and videos.
And they can reach at home also, or only in the dental office?
Yes.
Mm-hmm. Okay, thank you.
Thank you.